Hello everyone, welcome to my YouTube channel. So we are going to be looking at something very, very important that has to do with direct oral anticoagulant. Direct oral anticoagulant. Basically, what we are going to be looking at is who should we not prescribe this drug to? Meaning who should we not give this drug, this oral anticoagulant to? Okay, before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So let's look at this. So I went for interview and then I was asked, interestingly, that happens to be this, was it the second to the last question? And then I was asked if I could tell them who should not be given Doac, who should not be given Doac, which means direct oral anticoagulant. And I did thought about it. I gave answers that I didn't have confidence at the time, but I think that the answer that I gave, why the panel didn't quite accept that, because I did ask them their own opinion. I think my findings suggest that the answer I gave is correct. However, I guess because I didn't have much scientific evidence to back up my answer, maybe that justifies why I had to accept their opinion. So, but that's by the way. Who should we not give Doac? Who should we not give Doac? So first of all, before we answer this question, I want us to first of all ask ourselves, let us ask ourselves, what is Doac? So Doac is a form of anticoagulant, or rather is actually an anticoagulant. You know, when you talk about warfarin, you talk about heparin. So Doac is also another type of anticoagulant. So the full meaning is direct oral anticoagulant. That's why it's Doac. That's DOAC. Okay, direct oral anticoagulant. Right. So now, if you look at it with something like warfarin, we know that what warfarin does is attack or antagonize vitamin K, and vitamin K plays a major role in the clotting cascade. Then when you look at something like heparin, what it attacks is something like thrombin. Okay, so it kind of attack or maybe add on thrombin, and that of course is also found at the common pathway, and then that attack on the thrombin will not inhibit the formation of the clot. Okay, but when you talk about Doac, what Doac attack is factor 10A. And if you look at your clotting cascade, you are going to see that this factor 10A is what that helps to activate. Following its activation, then the common pathway can now progress up towards clotting formation. Okay, now, so Doac, who should we not give Doac? Now, there are a number of things you've got to understand because of the role of this Doac in the activation of the progression of the common pathway, part of the clotting cascade. What it means is that we need to consider carefully before giving someone this type of anticoagulant. Remember, with warfarin, it just attack vitamin K. I've said with heparin, then it will attack thrombin. Okay, now with Doac, what is going to attack is factor 10A, and like I said, that factor 10A, its activation will now help to progress the common pathway leading to the clotting formation. Okay, right. So now, what are the example of Doac? Just in case if you go for interview and they said, can you give us example of Doac? The secret I'm going to give you is BAN. So any of the drugs that are within BAN family, they are called Doac. For example, when you say something like rivaroxaban, that is a Doac because of the band that is there. If you say endoxaban, again, because of the ban there, okay, that is DOAC, okay. If you say apixaban, again, because of the ban there, that is DOAC. So once you hear the name of the drug that ends with BAN, that's ban, it is likely in terms of anticoagulant that you are referring to DOAC. All right, I think I've made that point clear. The real answer there is, who should we not give this DOAC? All right, okay. Now, let's look at that. Because of the effect this DOAC will have on the antenna, thereby inhibiting the progression or delaying the progression of the common pathway. One of the first people we may consider are people that has renal impairment, any form of kidney impairment, not just form of like very severe kidney impairment or severe renal impairment. Such people should not be given this DOAC. Now, the reason is this. Remember that kidney, obviously, we're going to also talk about liver as well. Kidney plays a major role when it comes to drug, okay? So remember that when somebody take this drug, okay, so kidney plays a major role to make sure that maybe, should I say, the toxicity of the drug, as the case may be, is, go out maybe through the urine, if that makes sense, okay? Because of the role of the kidney with the excretory system in terms of passing out urine, okay? Now, what it means is that if there is any form of impairment on the kidney, severe impairment on the kidney, that could make this drug to accumulate instead of its excessive or maybe toxic effect to be, as to be secreted out, to be secreted through urine. So any form of severe kidney disease will now inhibit that primary function of the kidney, and that would then lead to the increased risk of what? That drug accumulation, okay? And of course, that may lead to bleeding. That is why if someone has a severe kidney impairment or severe renal impairment, that person should not be given DOAC. Right. So because I'd already mentioned liver, the second one as well is where there is a severe hepatic impairment, okay? Severe hepatic impairment. Remember that your liver help to metabolize drug, okay? So what it means then, if one of the primary function of the liver is for metabolism, okay, what it means is that any impairment on the liver, so severe hepatic impairment or severe liver impairment, will now affect the rate of that drug metabolism, okay? And of course, that can now, increase the bleeding risk, okay? The possibility of the person bleeding. So again, someone that has impaired or severe hepatic impairment or severe liver impairment should not be given DOAC. Now, if you look at these two things I've mentioned, one of the things you're going to see is not because of the DOAC as it were, is the fact that the end product of that DOAC, are you getting me? There is something that is dependent on both the kidney and liver to be able to help. So for example, in terms of the liver, it should help to break it down, to metabolize it, okay? So now, if that is not done, that can cause a risk, okay? And that can increase bleeding. So someone with renal impairment or hepatic impairment should not be given DOAC, right? During that my interview, the example they gave me is one I'm going to give to you guys, okay? These were the example they gave me. So, which was someone that has a mechanical heart valve. Someone with mechanical heart valve, okay? So there is a mechanical heart valve. Such people with mechanical heart valve should not be given DOAC, okay? Now, this is because, when you talk about the thrombosis, okay, so when you look at the thrombotic risk, the possibility, the role of the heart, okay, in terms of the blood circulation and all of that. Remember, the presence of the valve, that mechanical heart valve, could, can have effect on the the role or the way the blood is circulated or pumps, if that makes sense. Okay, now what then happen, so what it means that because of that, if you give somebody DOAC, that will become ineffective. Are you getting me? Okay, it will become ineffective, and because of the ineffective of this DOAC in somebody with mechanical heart valve, that is likely to increase the possibility of clot formation. So it will increase what? Thrombotic risk. Okay, so it will increase thrombotic risk. So because of the possibility of this DOAC increasing thrombotic risk, that is why it's important that someone with mechanical heart valve should not be given DOAC. Does that make sense? Actually, studies have shown that preferably warfarin can be given. Okay, but anyway, so I had mentioned severe impaired renal function or renal disease or impairment, or severe hepatic or liver disease, and of course now I've mentioned mechanical heart valve. Okay, so someone with mechanical heart valve should not be given DOAC. All right, now another thing you may need to consider is the possibility of where, and this is actually the one I told them, when I went for that interview. I mentioned something like hemophilia. Okay, but they didn't quite accept it, but obviously I've done my research, it should be one of it. Okay, all right, so when someone has active or high bleeding disorder, once somebody has a possibility of high bleeding disorder, people like something like someone with hemophilia, okay, or someone with thrombocytopenia, meaning that the thrombocyte, okay, mean that platelet basically is low. Do you understand me? That means the person is prone to bleeding. Or hemophilia, where the person again is prone to what? Bleeding. Remember? Okay, now when we talk about factor 8 and factor 9, like hemophilia A or 9, hemophilia A or B. Okay, but anyway, someone with hemophilia or thrombocytopenia, that means they are likely to bleed. Such people should not be given DOAC. Okay, or someone who just recently conducted a major surgery should not be given DOAC. So I've mentioned for group of people here. Another group has to do with anybody that has a possibility of like thrombotic risk, like in a case of where blood clots can form in the blood vessel, as the case may be. Such people, like I've mentioned, I think this should be almost the same with the ones with mechanical heart valve. So, but let me still include it, something like antiphospholipid syndrome. Antiphospholipid syndrome. So anyone with antiphospholipid syndrome is likely to develop thrombotic risk. Anyway, so this person as well, or this group of persons, should not be given DOAC. And again, someone that is pregnant, okay, pregnancy, or the person that is breastfeeding should not also be given this very DOAC. Okay, so these are the group of people that actually should not be given DOAC. So if you do go for interview, I think there are obvious ones. There are so many of them, but I just thought I should mention the obvious one. So if you go for interview and they ask you, who should we not give DOAC, or who should we not prescribe DOAC for, you might need to consider severe liver disease, severe kidney disease. Okay, and again, you might need to consider a mechanical heart valve. Okay, and then of course you might need to consider someone with active or possibility of what? High risk of bleeding, okay, like hemophilia or thrombocytopenia. And of course, you can consider in the case of pregnancy or breastfeeding. So here you go. If you are asked, who should we not give DOAC? This is your reason. I had already mentioned that one of the reasons this is the case, unlike other type of anticoagulant, is because of the role of this DOAC in antagonizing factor 10A. All right, thank you very much for listening. Please do let me know what you think about the video. Can I ask you to like, share, subscribe? I wish you all the best till I come back away again. Bye.